Hello everyone, my name is Yelizaveta Polachuk and I will be talking about the future of nursing. A little bit about myself. I graduated from Mohawk Valley Community College in 2021 with my associate's degree. I am currently a registered nurse at Upstate Medical University on the Medical Intensive Care Unit. I am currently working on my Bachelor of Science in Nursing at Delhi State University of New York, and I would like to become a certified registered nurse anesthetist in the future. So what is the Future of Nursing document? The Future of Nursing document is a study that predicts the pathway for professional nursing to help create a culture of health and improve the health and well-being of the United States population. This committee works on the current problems, uprising crisis, and future changes. What is the impact of the professional nurse on today's healthcare environment and that of the future? Nurses are healthcare providers. They provide healthcare and impact the healthcare environment in many different ways. There are licensed practical nurses, registered nurses, advanced practice nurses. Nurses advocate and make decisions on many different levels of care and work with other healthcare professionals to improve the healthcare as a whole. It is important that in the future, nurses do not stop expanding their capabilities and responsibilities. Older nurses who have been gaining knowledge and expertise will retire and new, more diverse population will take on. Not only the nursing population is rapidly changing, but the overall population of the United States is also changing. The structural racism, poverty, discrimination is the new focus of the healthcare. Widening variety of new diseases such as COVID-19 that has changed and will be changing the healthcare system. Mental health that was often overlooked has become a big issue that nurses are capable of taking a part of changing. What is the impact of profession of nursing on the society? Today, nurses have a variety of opportunities. Nurses have been advocates for health equity and have been working on the root causes of poor health. Nurses work in a variety of settings such as prisons, hospitals, school, long-term care facilities. They help in so many different circumstances like social situations, like lack of resources, homelessness, lack of food, lack of adequate care or assistive devices, and lack of knowledge. One example of how nursing can impact the future of healthcare. The US population will not fully thrive unless the individuals can live their healthiest lives, regardless of their income, their race or ethnicity, or where they live. Many individuals cannot access health care because of lack of insurance, inability to pay, and lack of clinics or providers in their geographic area. To bridge this gap, access to care is expanded through a variety of settings where nurses work, including the federally qualified health centers, retail clinics, home health and home visiting, telehealth, school nursing, and school-based health centers, as well as nurse-managed health centers. Across all of these settings, nurses often serve as a bridge to social services as well. Nurses are leaders. Nurse leaders have the potential to dramatically impact nurse well-being by shaping the day-to-day work life of nurses, setting the culture and tone of the workplace, developing and enforcing policies. The leadership style and effectiveness of nurse leaders have been associated with outcomes including the health of the work environment, patient outcomes and mortality, job satisfaction, work engagement, burnout, and retention. The specific ways in which leaders can impact nurse well-being depend on their role and scope of authority and responsibility. Nurse executives with influence over organizational policies can advocate for adequate pay and benefits and addressing staffing and scheduling issues to prevent nursing from being overworked. Nurse leaders who manage teams can support well-being by addressing workplace safety and bullying and by creating a culture which all nurses feel supported and respected in. In the conclusion, nursing is holding a bright future as a profession. By focusing on the new upcoming changes and expanding our roles and capabilities, we are able to help the population and the healthcare system. Nursing theorist Dorothea Orme stated, "Proper object of nursing considered as a field of knowledge and a field of practice. Combining knowledge and resources, nursing will be able to make a positive impact on patients, nursing profession, and interprofessional team care."